there is concern that UNH is extensively overbilling Medicare, and thus you, the taxpayer, by adding diagnoses to patients that would trigger extra payments. Some doctors told the Journal that they were effectively trained by United Health to document income-generating diagnoses that would be obscure or even irrelevant otherwise. And the paper says that could have amounted to billions in extra revenue for UNH. We've obviously reached out to United Health Group for comment. We have not yet gotten a response. The company did weeks ago put out a statement to a separate story by the Journal saying it is not aware of the DOJ's actions. Let's talk more about what we know and about the industry in general with Dr. Robert Pearl. He is professor at Stanford University School of Medicine and Graduate School of Business, also the former CEO of Kaiser Permanente, one of the nation's largest not-for-profit health plans, I believe the largest, serving more than 12 million members. Dr. Pearl, thanks for joining us. I don't want to go into the allegations specifically against United Health Group. It is a Wall Street Journal story. It is not our story. But that said, what you know about how the industry works, would it be possible for an insurer to add on? Somebody goes in, they gets checked out, and a doctor or a nurse or an administrator adds billing codes to their systems without a patient's knowledge?
You have to differentiate what you're calling billing codes, which is I see you in the office because you have a broken arm, and I fix the broken arm, and I bill for that, as opposed to the way that United Healthcare is being paid by the federal government, which is what the allegations are about, which is specific to Medicare Advantage. There they get paid a set fee. We call it a capitation to take care of a patient, and it's based upon how risky, how likely it is the patient's going to become sick. So if they're adding on diagnoses, but they haven't yet manifested in a medical problem, that's okay. If they're adding on diagnoses that didn't exist or exaggerating the diagnoses that do exist, that is not both improper and illegal.
And we don't know, and I want to be very, very clear, this is the Wall Street Journal multi-month investigative piece. It's on their website. People can go read it. UNH is clearly probably circling up the PR and the lawyers right now, and I'm sure we'll get more of a clear response by them. But this is also a company, it's under DOJ investigation for antitrust violations. Oh, and by the way, had one of their CEOs, their group CEOs, murdered on the streets of Manhattan. Just throwing that out there, largest health insurer in the United States. But would it even, doctor, be possible for someone to add? I go in, to your point, I've got a broken arm, and I go in, and they say, well, you're a little heavy, and they start adding some pre-diabetic codes without my knowledge, or some sort of diagnosis without, and that's key, without my knowledge, and therefore gets paid by Medicare for something that I, as a patient, am not even aware of.
You would not be aware of any of the codes that they are submitting to the CMS. That's just the coding for your diagnoses. It's not the documentation of the care delivered. It's a documentation of the diseases, the problems that you have. So yes, you could theoretically have obesity, and as a consequence of that, have a set of measures that would indicate the hemoglobin A1C that you're pre-diabetic, and conceivably the doctor wouldn't tell you. I'd hope that the physician would tell you about that, but it's certainly conceivable that there are diagnoses that could be added that would be submitted for billing and added payment, and you as a patient would have no idea because you didn't come for that particular problem, and it wasn't relevant and very significant to why you were there that day.
Dr. Pearl, the timing of this is all quite emblematic, right? We have a DOJ committee out there. We have this huge effort to cut the federal deficit. How much spend is potentially being wasted because of issues like this?
There is a large amount of dollars in healthcare that I believe are being wasted. The real question, though, is how are they being most significantly impacted? And I think that the fraud piece of it is smaller. And the government, of course, makes adjustments all the time to, in essence, decode, reduce the coding payments that are being made. I think, though, the biggest problem is that the whole healthcare system is broken. It's a system designed to take care of you after you get sick. It's not designed to keep you healthy. What we know is that 60% of Americans have chronic diseases. And according to the CDC, 30 to 50% of heart attacks, strokes, kidney failures, and cancers result from these. We do a poor job managing them. Imagine the cost reduction that would happen, the reduced payments by the federal government if we had a healthier nation.